Welcome, everyone. We are so excited today for our monthly Hope session, helping our parents excel. We have a doctor with us today who just happens to have a sweet bedside manner and passion for serving our individuals with autism, young and seasoned. So I also have my dear friend. Here is Evelyn Traylor, who's going to introduce the doctor for us today, and then we'll get rolling, hopefully gain some information. So Evelyn, I'll let you take it from here.
All right. Thank you so much. And I won't age us, Darla, that say we've known each other for 12 years or so now.
Yeah.
Yes. So, but it's, we're through the community. We both do lots of things in the community. So thank you all too. And of course, I was at the very, very first Hope for Three luncheon you had at Tammy Brown's house, and that started all of Hope for Three. So, and it just, I'm so proud of you all where you are today, and welcome to all you parents that are there.
Thank you.
Yes, you bet. So I want to introduce Dr. Zaidi to you. And then unfortunately, I'm going to need to leave because I have another meeting to go to, but I wanted to be here for this part at least. And so I've known Dr. Zaidi for a few years now, and a wonderful doctor and wonderful family man and so on too. He graduated in May of 2004 from the Rawalpindi Medical College in Pakistan. And after graduation, he had many years of experience in Pakistan, Oklahoma, Illinois, and now he has his own private practice here in actually right here in Sugarland. So I'm almost a staffer. So I was like, okay, I'm not in Sugarland yet, but in Sugarland. And it's just off University Boulevard. And before you finish today, Dr. Zaidi, would you please give your address and so on?
Sure.
But some of the things I wanted to tell you about is the sports and honors he had during the graduation years and so on, is he had top positions in disc throw and table tennis. Man of the Year 2002, awarded to a well-rounded person with the ability to maintain a balance between curricular and extracurricular activities. Because I know many of us know what a schedule you have when you're becoming a doctor.
Yeah.
And so on. So if any of you want to give him a challenge with table tennis, I'm sure he's still good at it, right?
I hope so.
Might be a little bit too busy to practice lately, right?
Yeah, it is.
Yes, he is a diplomat of the American Board of Family Medicine, of course. And he has his own practice now, and he'll tell you more about that. And I told you the different places he's been in. So I've got the page changing. He has 4 pages on his CV, is what doctors call their bio. So very experienced and a very talented man. And in our conversations, when I have met Dr. Zaidi, that he commented that he does really care about autistic families and has experience there, and with autistic kiddos that they may get a sore throat, or I know all your children get exactly what all our kids got too, with sometimes could be a sinus infection or who knows, right? So anyway, the hobbies and interests he now has is reading history books and classic novels from English and Urdu literature. His favorite sport is cricket. He used to lead his medical school cricket team, was able to bring gold medal back to school for 10 years due to his leadership skills and management during that time. He is fluent in English, Urdu, Punjabi, and Hindi. So please welcome Dr. Zaidi. Clap, 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 clap.
Thank you so much, guys. I think most of the things I forgot myself, Evelyn. Probably it's in my CV yet, but thank you so much for introduction. Okay, so let me just start by saying that it's very hard and challenging to have kids who have special needs. I was just hearing, I think Ms. Fox, that she has recently, son has recently been diagnosed with autistic spectrum. Yeah, and after diagnosis, then there is a whole new series of challenges that come across, and it's a whole system that you have to deal with and go through insurances problems as well, schooling. So I'm a primary care doctor here. As most of you already know, that for autism, it's a teamwork. It's from the time when we suspect that kid has autism, probably should have been suspected very early, around 18 months or 2 years. If we diagnose before 3 years, the chances are better outcome long term. So being primary care, the role starts from the identification, and then once we screen them, then we refer them for formal diagnosis and evaluation by either child psychiatrist and pediatric neurologist. Also, we have to involve occupational therapists. There's a lot teamwork goes into it. But as most of you know that autistic kids or kids in this spectrum, they have very high sensitivities to changes. It's good to have a primary care office that they can get familiar with. They can go for lab workup, they can go for illnesses if there is any, or just generalized screening or immunizations or lab workup. There are certain diseases that go with it. They can develop some nutritional deficiencies. Constipation is very common due to the GI problems. Anxiety and depression is very common with kids. So these all can be at least monitored, and then proper referral can be made. And of course, family support, because there are a lot of questions parents have. It's very nerve-wracking to go through a whole process. But if primary care offices can have a process where they can talk to family and walk with them with the whole process, it just helps for the whole community and the family so they have some place. We have in our clinic, there's a group home called Lifetime Home Care. I'm not sure if one of you know them or not, but they take care of kids with special needs on autistic side, but their kids are mostly around 16, 18, or even when they become adult. So they provide them with the services there. And they started bringing to me last year their people or patients who are there. At that time, I had a huge exposure with people who have autism throughout their life, but they are now in adulthood. So, and still they are going through this and need special need. But after 1 year now, today, in fact, this morning, I had like 20 of those just coming in for lab draw. And the only reason they come here because they are familiar with the place. It's easier for the office staff to manage once they know them, that, okay, this is routine, they have been here before. So this is the nutshell that what we do here and how can we help. It's it's like a base center from where we can then manage the whole process or guide and support families as well. I'm not sure how many of parents today who are in the meeting, it's very new into this, and if they have questions about how Asperger's, the autism spectrum disorder, why does this happen? Is there a role of vaccine in it or not? There are a lot of complementary or alternative medicine approaches outside there. Some have benefits, some have no benefits, some have no benefit and no harm. Like music therapy is documented that it helps. Horse riding helps as well. These are the alternative approaches other than the medical therapy that goes on. Some people prefer to have or choose to go gluten-free and casein-free diet. Those two diets have some benefit, but it can bring vitamin D and calcium deficiency. They can get the bones weak. So if any of you have questions on that side, I will be more than happy to try to address it as well. Or if they have question about sleep issues, that is very common with, or anger and some behavior issues that require medications as well. I can help or try to help on that as well. Okay, yeah, that's what my first thought was, that if we know that this happens in winter, then do we need to manage medications with psychiatrist help, that knowing that this will happen at that time, do we need to adjust medications at that time and see if
Right.
that helps? As you know, also on autism spectrum or Asperger syndrome, the kids are fixed on one routine. They, they do not like changes at all. Does that also implying on changes in behavior in certain time of the year to him? It's a possibility. It's hard to answer your question with 100% conviction, but uh, that is what it seems like to me. And if you guys are adjusting the dose, I think it's a better idea. And it doesn't hurt to have more than one opinion. If you have been with one psychiatrist for long, it doesn't hurt to have another opinion. I have a 12-year-old autistic kid, mother brought in, um, just because I happen to know someone in the family, and they knew that I don't treat autism, but I do take care of kids for their primary care needs. She just wanted to discuss that she is not happy, that how the kid is doing at this time, very volatile, very disruptive at home. And they have the psychiatrist. We spoke with the psychiatrist, and she explained that I think the management is right. I just happen to know someone in LA, one of my class fellow, he's a child psychiatrist, and I spoke to him that this is the management going on. Do you think you need any change on it? And he suggested to change the dose of Risperdal. It's very common medication, risperidone, and Abilify. So just changing the dose from one to other, or changing the timing. After a period of 2 months, he was comparatively better. It was acceptable for her mother. And it was not that the previous psychiatrist was doing something wrong. Sometimes we just do not look outside box, or do not tend to change things. And having another mind on it, it doesn't hurt. So I will suggest that might not be a bad idea to have another opinion and see if from a child psychiatrist, from a different child psychiatrist, and see if they have something to add on it.
I have a follow-up to that, but I think Melody has a question. Melody, do we want to what degree, and I think you've kind of answered this, but Melody, are we correct in what degree does he serve the children with autism? I think he kind of recommends them out, but I think that's her question. Do you serve children in your practice, and to what degree?
So as I mentioned, my role can be as simple as just treating them for acute illnesses,
Okay.
or it can be as extensive as starting from suspecting that this kid has autism, referring them for the proper evaluation, and then managing them with the other team, and uh, supporting parents as well to walk them with it, that okay, this is our next step, we have to go there, and this is how the coordination will work. So it can be as simple as treating sore throat for them and just bringing them and developing a routine for them, that they have one clinic where they can go and get familiar with it for their needs, or it can be extensive as well.
Wonderful. Wonderful. And definitely before we hang up, we want to get your address because he does have a new practice, relatively new. He's been around a while, but on University by Riverstone. So it's very
Yeah.
convenient for all of us. I'm super excited about that. And I have a question is that I don't have a child with autism, but I've been with Hope for 10 years. And I don't mean to offend your practice, but it's a question that always makes me curious. Most doctors, just regular GPs, do not really have the experience or understanding always to recognize the kids with autism. So, is it your opinion that we recommend our children go to a pediatric development doctor or a neurologist? Are those the correct two referrals?
Right. So from a primary care perspective, the first role of either a pediatrician seeing your kid or a family practice seeing your kid, it's very common that we have to do every year their milestones check, right? So if we are missing on our, especially if kid is 1 year old, and if we are calling kid by name and kid is not responding, this is the first red flag there. And this goes on with milestones that 18 months, 24 months. So once we know that, okay, there is a problem, this is the responsibility of either me as a primary care doctor or a family physician or a pediatrician. And everyone should be doing it. It's not that, and it's very standardized. CDC has guidelines, you just follow through, you do the check. And once we know that, okay, there is a problem, then the next step from my side is to send to a specialized assessment place where it cannot be just a child neurologist or a child psychologist. It should be an institution. If my screening is positive, then I do not want them to go somewhere where they cannot have all the answers. So it should be referred to proper institution who deals with autism. Texas Children has very good setup for it. And they do all the diagnosing part and then behavior modification part, and we can continue the therapy there. I don't know if I answer your question or not.
No. That did. It's just we're finding that our just normal GPs don't have as much education and experience as you do.
Right.
And so we want our families to get that best. So I'm super excited that
And
you're in the area.
no, and I hear your point, and it's just because not many. So we live in corporate medicine world.
Yeah.
If you see that solo practitioners are not very common now, mostly these are private practices that are owned by corporations. So if I am hired by corporation, I am being paid for 15 minutes for a patient, and then my clock is running. I have to go to next patient 15 minutes, next patient 15 minutes. It's unfortunate, but this is how it is at this time. If we do not have this clock on back of our mind, then we can have this time to look carefully, to do some milestone checks as well. I agree with you that yes, being primary care, we are not as accustomed to look for or to especially treat. As I mentioned that I from the very first point, I said that I don't treat autism.
Right.
I do support parents. I do primary care for autistic kids. A short answer to your question is every primary care doctor should look for it. And it is very standard process that every pediatrician or family practice does.
Okay. Perfect. Melody had another question. It's in the chat, but Melody, if you want to ask it as well, go for it. Yeah.
Hi, how are you?
I'm good, Melody.
So my son has a limited diet. Of course, he has some food sensory issues, so there's only certain things that he eats. He went from eating, puree food, baby food last year. Now he eats a few solid food, but nothing with a lot of nutrition in it. And so I was wanting to know, like, the liquid drops vitamin D, is that okay? Or what other vitamins and do you recommend, and how do you recommend giving it to him?
So the diet that he's using currently, do we know the exact nutritional elements in it at all, or it's just we're not sure?
He goes to an ABA clinic. They're trying, and he's on a food therapy program where they try to introduce new foods every week. But the only foods that he eats is a handful. He'll eat bananas. That's the only fruit he eats. Doesn't eat any type of solid vegetables, none whatsoever.
How about meat?
No.
Okay.
Cheese. He'll eat cheese pizza, Eggo waffles, muffins, Oreos, certain chips, Life cereal, Fruit Loops only. That's about all his diet, and peanut butter jelly sandwich. That's it.
How about milk and shakes?
Yep. Yeah, I do give him fruit, like in milkshakes. I mean, I give him one every day. I give him Pediasure, but any liquid type of form shakes he'll drink. Chocolate milk, regular milk, but that's about it.
Okay, so most of milk products and dairy products within United States, they are all vitamin A and D fortified in it. If he's consuming those, so very less likely that he should be getting deficiencies of vitamin D or vitamin A there. Now, if does he consume eggs or poultry at all, or no, then and he does not consume any meat as well, as you mentioned. The only thing that comes to my mind is probably vitamin B12, sublingual vitamins should be part of his medications if he's not consuming any eggs or meat there. Other than that, if he's taking all that you mentioned and he's not losing weight, then we should be okay. Nutritional deficiencies, if they are severe enough, they come with some signs and symptoms with them. As I mentioned, that if someone is deficient vitamin D or calcium, they will start having bone pain, muscle pain. They might get injured lightly, but the effect can be severe on their bones. If someone has vitamin B12 or vitamin B6 deficiencies, there are signs and symptoms to look for. Like if like iron deficiency or B12 deficiency can show up as anemia as well. Just simple blood draw can show them. But first thing, always go back, how is kid doing? Are there any red flags that being parent you notice or the physician is noticing? If there are no apparent change in health, like simple weight loss or extreme weight gain, then there's nothing much to do. It's a good thing that you have this thing in your mind that a specific type of food kid is consuming. Are we missing anything? I think in your situation, only vitamin B12 I will suggest add. Otherwise, rest of them should be okay there.
And you can find B12 in liquid form?
Yes, it is. I know it's for sure prescription, but I'm not sure over the counter they are available as a liquid or not. You can look into it, but it is available through prescription for sure.
Okay.
Excellent. Good question.
Thank you.
Rowena, do you have anything you'd like to talk
Sure,
about?
I'll piggyback off of what Melody was asking. So I have two boys on the spectrum. One is very, very tiny. We had a little bit concern about his growth. He was in 3 percentile for the longest time. He just recently graduated 4 percentile. We're seeing an endocrinologist. We did the bone scan. We did all his vitamins. He's completely healthy. And what it came down to it, if you're not seeing regression, he's happy, healthy, progressing, steady incline. There's really nothing to worry about. He's doing good. He's happy. I can understand your concern because you're probably like comparing your son, like, oh, my kid's not eating that, or whatever. I mean, my kids don't like pizza. So can you imagine when there's a pizza party at school? I'm like, come on, eat pizza. Everybody likes pizza. So that's completely normal. And then he did mention there's a B12. So what we have is a mouth spray, B12. But of course, ask your physician first, as the doctor would agree. But I really, sir, I really appreciate you coming on here. It's very hard for families finding physicians who actually bridge the gap opposed to just passing us along. It's very important to have that type of relationship.
Yes, right.
Don't be afraid to ask your physician, don't you want my notes from OT? Don't you want the notes from speech? Because all the modalities, they don't talk to each other, but your GP is going to, and he's going to be that, although, that's not their specialty, he is going to be that engine who could direct you even better.
Yeah.
So, so thank you so much for being here. And I really appreciate your proactiveness and connecting everybody. Well, that's my input, but
Thank you so much, guys. Guys, I will have to go. There's patient waiting for me, if you guys don't mind. And my practice, as she mentioned, on Riverstone, if you just type Google Hammad Zaidi, it will show up. My clinic name is ANU Family Medicine. It's my daughter and son initials. It just yeah.
Well, this was and I was really thankful and grateful that you do bridge that gap with our families, because there is an area that we can't find good, strong doctors. So happy to have met you and for you to share your expertise with us, and good luck with your patients. And we hope to visit with you again. Okay.
Thank you so much.
Bye-bye.
Thanks so much,
Thank you.
guys.
You're very
Bye.
yeah.
Bye.
Bye now.
Bye.
Take